Hi, it's Jami Gossett, and I'm here with my husband,
Dr. T.K. Gossett.
and today we're going to be talking about our back pain protocols. Recently, you may have seen some of our wonderful testimonials. One in particular was Chuck. You remember Chuck? He's a farmer from Bement, Illinois, and he had an amazing experience here. He had been through absolutely all the medical stuff and really had a lot of pain and a lot of problems, and so he came to us. So what we thought might be interesting is to kind of go through our process and how we help Chuck, and then I'll put in the comments his link to his video, and then you can see in his own words how things went with him. But what I want to talk today about is, people say to me sometimes, how exactly do you do this? So let's just talk briefly about like how you start out with working with people orthopedically, neurologically, and metabolically, which are the three pillars of health from the Gossett factor. So tell us, the very first step that people would have with this is an exam. So tell us a little bit about your exam and what you strive to do in that and how it's so different and unique from everyone else's.
Okay. First of all, we have patients fill out some exhaustive forms, which gives us a deep history as to their medical history. Many people have back problems today, but were caused by accidents and injuries and incidences that occurred 5, 10, or 15 years ago. So we start with that, and then I go into a preliminary type of orthopedic exam to check the posture, the hips, shoulder, and head levels, and the spinal alignment. Now, if there's extremity involvement, then I check those extremities for alignment problems as well. After that, then I go into an in-depth orthopedic exam checking the patient's range of motion, whether it's in the neck region, cervical region, flexion and extension, lateral bending, and rotation. If it's mid-back, lower back, we do that in those areas. That's the thoracic and lumbar spine as well. We also look at the muscle strength of the extremities of the spinal muscles and the deep tendon reflexes. So that gives me a good idea of structurally what's going on. Mm-hmm. Now, if a person has a structural problem for weeks, months, or years, maybe even decades, then oftentimes a degenerative process is started, and that becomes a source of a lot of problems that's overlooked by a lot of doctors. So the structure is important. If that's gone into a degenerative state, then it will oftentimes affect the neurology, either at the nerve roots or the spinal cord, or in the periphery where the muscles cross those nerves, where those nerves exit through several different types of muscles. Those can become tight and put pressure on those nerves and cause nerve entrapment. Mm-hmm. Then the last thing that we check is also the person's internal body chemistry, because if their body chemistry is off, oftentimes it's inflammatory in nature, and that is like throwing gasoline on the fire. Mm-hmm. So those are the three things we look at.
Right. And I've had people tell me, I have never had such a thorough exam because, you know, you go to the foot doctor and they look at your foot. You know, you go to the hand doctor and they look at your hand. Right. But we treat the whole person. And so your exam is very thorough, orthopedically, neurologically, and metabolic and health history. Very, very important. So for Chuck, he came in and he sort of ticked all the boxes of what was going on with him. And so then you felt like that you found the root cause and that you could get to the bottom of his problem and shift it for the good. And so talk about some of the therapies that we use with Chuck or with other folks when we're working with back pain and back problems. Now, when I say about back pain, I'm not just talking about like last weekend I strained my back. I'm talking about serious problems. Tell us about some of the serious back problems, or if you could just list some of the serious back diseases or problems that we work with.
Okay. Patients often call with mild sprains or strains of the muscles and ligaments, and that's a traditional chiropractic or physical therapy type of situation that is amenable to just a few weeks of care. If they've had this condition for a long period of time and degeneration has set up, then you have things like degenerative disc disease, in other words, narrowing of the disc space. Degenerative joint disease, that's narrowing of the disc or joint spaces in the back part of the spine. The disc is for weight bearing, and the joints in the back of the spine are for motion, forward, backward, side-to-side bending and the rotation that I talked about earlier.
Stenosis, that's what one of the things.
Spinal canal stenosis or nerve root stenosis. Spondylolisthesis. I think that pretty well covers it.
Bulging and herniated discs.
Of course, yes.
That's a huge one.
That's a huge
and failed
one that we
back
take care
surgery.
of on a daily basis to help prevent.
For sure.
And even patients that have had back surgery that's failed, oftentimes we're able to help with this procedure.
When you're talking about things that are just mild strains and that kind of thing, that's not the kind of patient that we see. Our practice has been a chronic condition practice for almost 15 years now. Dr. Gossett only deals with the worst cases that have not been helped with traditional medical means or even traditional chiropractic care. And even we're going to talk about decompression. Some people have even been through decompression programs and are still not well. And we'll talk about how our program is very different from just a decompression program.
Right.
So let's
Can I also say I've been in practice for 40 years, and the first 25 years was the traditional approach to treating the sprains and strains and that type of thing. It's this last 15 years that have been focused on the more degenerative conditions that weren't responding to traditional methods.
Right, and we've invested thousands and thousands of dollars into equipment that address these kinds of problems in a very specific, targeted way.
Cutting-edge technology.
And hundreds of hours of postgraduate education on your part to put yourself in a position where you are the expert who can do this. So that's just something that we wanted to share. So let's just talk about, because people are like, well, exactly how do you do that? So let's talk about some of the therapies that we use. Of course, we do some chiropractic adjusting. And tell me about that and what you would use to...
For individuals that have degeneration, the last thing they need is someone manually adjusting them. What we do is use instrument adjusting, which is very light force and very specific, to put to correct alignment in a very specific and yet gentle way, and then move on from there.
Okay, so that's one of the first things that we do, and then we have something called the rapid release technique. So can you tell me a little bit about that and how it's used and what it does for folks?
So some physical therapists came up with some research to find out what frequency of vibration it takes to actually break down muscle spasm and edema and scar tissue. And they developed a vibrational unit called the rapid release unit to vibrate and break up scar tissue, break down muscle spasm, and help to alleviate some edema as well. So we use that right after the exam adjustment if that's necessary.
Okay. And so then we also use something called far infrared heat. So tell me why we use that and what that does for people as they get ready for decompression.
Far infrared heat is the most effective way to heat the muscles and relax the muscles and start to decrease the edema that's in chronic muscle spasm. So that prepares them for what's to follow.
Plus it's very comfortable, and most people fall asleep while they're on it. And so we should say that at this part that we're talking about is almost 100% passive. The person just rests while these things are done.
In fact, during the first phase of care, most of it is passive, where we do all the work and the patient is laying there totally relaxed.
Yes, right. And many fall asleep just in the therapies that we do.
Yes.
So let's talk about decompression. We were the first people in Central Illinois in this region and to have a true decompression machine. So let's talk about decompression, and also let's talk about how it's different from like a manual traction or that some people are calling decompression in other offices, but is not truly true decompression.
Sure. It's a digitized or computerized type of traction. Traditional traction is motorized, and once it pulls and starts to create a decompression or a separation of the disc spaces, the muscles, the spinal muscles, automatically go into a protective muscle spasm, and so that stops any motion from happening. What this new technology does is allows those muscles a chance to relax. So it may pull 10 pounds, and as soon as the muscles kick into gear and stop it, then it goes back to 5 pounds. The muscles relax, then it pulls again 15 pounds, and then it drops down to 7.5. So it works with that muscle, with those muscle groups along the spine. And there are literally hundreds of muscles along the spine that are working to hold you upright And so if there's a strain there, there are muscles in different areas that are in a spasm protecting those areas, and that needs to be worked with and allow those muscles to relax so that you can actually get a separation of the disc space, which is going to open up the nerve roots, it's going to open up the spinal canal and take pressure off those nerves.
And protective muscle spasm is the reason why those who have possibly in the past gone and gotten traction for their back problems, why they're in so much pain or felt so much pain later on, is
Yes.
because this protective muscle spasm jumped in and then immediately caused pain, right?
And it doesn't let up with more traction. It has to be this special digitized traction. And there are many supposed decompression units out there, but 90% of them are traditional traction with a digital meter on there.
Right.
So it's important to make sure that your doctor, and we researched it for 18 months before we ever purchased a unit, has researched it thoroughly and knows that he has the technology that is really going to work.
Right. And so I want to speak to that, though, because even if you had two machines sitting side by side that were exactly the same, it's the physician who knows what to do with it. And I think that's part of, well, I think it is the secret sauce behind why people get such amazing results from you, is because you can have two machines going side by side and two different doctors in the same patient, and one get really good results and really not. It's not just the machine. It's really important that you understand you have to have the expertise of the person running it, because it is not cookie cutter. Correct?
So you don't want a doctor that's just started using this and is starting to advertise or market. We've been doing this, we're the first in the area and been doing it for 15 years.
Right, and it's not cookie cutter.
No.
And you have a very custom approach for every person.
Right. So
Okay.
the years of experience add to the ability to have a better benefit for the
Right.
patient.
So the decompression does what? The decompression does what to the joint or what?
Several things. It decompresses or stretches out, opens up the disc space, opens up the nerve roots, because whenever the disc space narrows, so does the nerve root. It also relaxes the muscles, stretches those out, and then it also breaks down scar tissue that's in the ligaments. The ligaments are normally like rubber bands that stretch and come back. Well, what's happened in these degenerative conditions is oftentimes there have been accidents or injuries or overuse that's caused a sprain of those ligaments, and so they're longer than they should be, and then there's scar tissue in there. Well, what this does is also break down that scar tissue and stimulate type 4 collagen, that actually tightens this up, and it's actually stronger than the collagen that you're born with. So as a result, you're actually going to be able to handle more stress than you would before you ever injured it.
Okay, and the decompression truly is an alternative to surgery, right?
Yes, definitely.
Yeah.
And even for some patients that have had fatal back surgery.
Right.
Because oftentimes the problem is then shifted above or below where you had surgery.
Okay, so we also have a therapy that's called Nerve Smart in our office. Tell us about why a back pain patient, how they would benefit from the Nerve Smart.
This is a new electrical technology that works at the cellular level to reduce inflammation and reset those neurons and to reduce inflammation. So it has a very positive effect on pain and swelling.
Mm-hmm. And so last but not really least, and this would be, just to clarify, when we work with a patient like this, you do it in two phases. The first is stabilization, correct?
Correct.
And so they would have some combination of these therapies, right? And so the last one in this is our EMF therapy, or pulsed electromagnetic therapy. Tell us why patients need to worry about having that, why it matters.
Okay, so once the stabilization phase is accomplished, which is meaning that it's decompressed and the ligaments are stable, the joints are stable, the ligaments are flexible and the joints are stable, then we're ready to move into rehab. And just like if you've had cardiac surgery, you have cardiac rehab. If you have back surgery, you have back rehab. That's what this is a continuation, the second phase being rehab. And we use some of these same therapies that we used in the first phase. Decompression is no longer needed, so that's discontinued, and we add PEMF therapy. Now, pulsed electromagnetic therapy is a technology that's been around for 20 or 30 years. It's MRI technology. It's using electromagnetic waves to diagnose soft tissue conditions. Well, this same technology has now been harnessed for us to use to treat soft tissue conditions. So by passing electromagnetic waves through the body in these areas where the degeneration is, it stimulates the metabolism at a cellular level of the nerves, the muscles, the ligaments, everything that is involved in these types of conditions, and actually stimulates the healing process. So it takes things to a much higher level and really accelerates the healing process.
Got you. So there are some more pieces to it, and I have a great handout that if you would like to have a written description of everything that we've been talking about tonight, I welcome you and invite you to call our office. We'll have our phone number listed, and you can have your own copy of a written description. But with Chuck, you know, he went through this process. It's been 3 years now, and we just recently sat down to talk to him 3 years later after he had gone through everything. And I was just so amazed and humbled at how great he's doing and how he has so much of his life back, and still farming, which is something he thought he was going to maybe have to give up.
Right. He's in his 50s, I believe.
Mm-hmm.
And these guys like to farm till they're in their 60s, 70s, and maybe even into their 80s. So he's glad to have his life back.
Right.
And to be active and continue. He also has a hobby of collecting antique tractors, and he has something like 40 or 50 of these antique tractors that he works on continually maintaining and keeping active for parades and that.
So you got to have a strong body.
That's
strong
right.
body. We help a lot of people do a lot of things again that they had to give up, and that's especially gratifying. So thank you so much for watching this, and thank you for going into the detail. If you're interested in finding out more about whether or not we could help you in particular, I welcome your call. You can talk directly to me, and we can discuss your situation. Now understand that there is, for people to have the kind of outcomes that they do, there is an investment of time, energy, and some finances. But if you are at that point where you just don't want to live with what's going on with you anymore, we would love to hear from you and love to see if possibly Dr. Gossett could accept you as a client, as a patient, and help shift your life for the positive too. Thank you so much for watching, and we'll see you next time.